A vasectomy is a permanent form of sterilization. What it entails is a small incision in the scrotum where we bring up the tube, which is the vas deferens, and we clip it and cut it and put it back in order to prevent the sperm from traveling through the channel in order to avoid pregnancy. A person that should consider a vasectomy is a male who's looking for a permanent form of sterilization and who wants to avoid using either condoms or having their partner on the birth control pill or an IUD, or having their partner undergo a more invasive procedure, which is tubal ligation. There are essentially two types of vasectomy procedures. One is called the no scalpel vasectomy, which uses a very sharp type of scissors in order to make a puncture hole into the scrotum in order to get access to the vas deferens. The other one does utilize a scalpel, utilizing one or two different small incisions. Both are minimally invasive, both have the same risks. They're just two different ways in order to make a hole to get to the vas deferens. There are a few risks that we discuss with our patients prior to undergoing a vasectomy. One is bleeding, which is less than 1%, where you can get an abnormal collection of blood in the scrotum or at the incision site. Another is infection, which again is less than 1%. We don't even give antibiotics prior to the procedure. It is a sterile procedure where there is we do clean the area with a solution to prevent infection. And the other risk is failure, which is approximately 1 in 2,000. And we define failure if we detect sperm in the semen analysis approximately 6 months from the time of the procedure. Some people can have long-term pain, again, very, very small risk with that, but otherwise it's a very, very safe procedure. The recovery time from a vasectomy is very minimal. We ask that you don't do any heavy lifting for about 24 to 48 hours. We do ask for post-operative recovery to ice the scrotal area off and on for, again, 48 hours. It's advised not to do any heavy lifting for the next few days, but typically people return to work the next day or 2 to 3 days later. And another thing that we advise against resuming is ejaculation for approximately 1 week. A vasectomy is a reversible procedure. However, it is best to go with the mentality that this is a permanent form of sterilization. 99% of them, vasectomies can be done in the office in about 15 to 20 minutes. Some reasons why we would not want to do it in the office is if you have abnormal anatomy, which makes it difficult, which would cause increased time of the procedure and potential pain.